identify barriers as well as facilitators, and then actually do some form of implementation, scientific interventions, implement. So we need to look at that in our respective units. That what value can this all this research add to what we're doing? Because we're supposed to do evidence-based practice, clinical practice. Then the other question is, who would research findings? Is it the researcher? Is it the participant? Is it research institution? Is it funders? Is it society? Well, we will all agree that the researcher, the resident, in this case, the resident, the fellow actually owns the research data, but not completely. There is some considerations I'll talk about later. So let's talk about access to research outputs. So a significant proportion of research output from the last suit residence training program is largely inaccessible due to, number one, low publishing rates. But our rate is not too bad. I saw a publication from a surgery program from somewhere in the east, and I think the publication rate was about 44%. So ours is 53.8%. When I look about the residents, but it will not be fair to look at all the fellows, because some have just let me use the word graduated. Some have just graduated this year. So maybe it will be too early to judge whether they have published at least one paper. So, and I looked at up from inception up to 2022. So with the assumption that, okay, within 3 years, the resident should be able to publish at least one paper. Okay, so before 22 up to 2022. So 65.6, at least one paper has been published from 65.6% of dissertations. So what happens to the remaining 30-something percent? They are not accessible. The candidate has done his or her own parts by conducting the study, by defending and passing, and has handed it over to the college. The college has kept them. The colleges have kept them. They are locked. They are inaccessible to the society. That's the implication of when research is not published. Yes, it is the researcher's duty to publish. You understand? But it's also research institutions' duty to also make research available for the use of society. Investments, we will not maximize. Hello? So well conducted research, successfully defended, submitted to academia, but locked up remains unpublished, it's a loss. That's where I come to think, could we say because decisions will not be if we didn't have that data and it was bag fellowship. Can you imagine how many babies would have died just because we were treating them with antibiotics that's how valuable research is, and that's how we should see it. So asking the fellows, how many papers have you published in peer-reviewed journals from your dissertation? So you will see that about 46.2% overall have not published any. But when you now look at, okay, fellows that completed their program between inception and up to 2022, so we see that it reduced to about 34.3%. That is 65.6% of dissertations have had at least one paper published from them. Now, what has been wasted? If research ends just at submitting dissertation, and dissertation is not available to to the public, to the end user. The end user in this case is not even is not primarily the researcher. It is the body of science. It is the global community. If research stops at just submission to college and no part of it, no even the abstract, not available, not accessible, the researcher time, time away from family, we say it has been wasted. Well, a fellow will argue, look, for me, the primary goal is to get my fellowship. Good. Participants' involvement, the time and the risk they are put into participation is also wasted. The supervisor's time, an opportunity for career academic progression is wasted to some extent. Considering the enormous time supervisor invests in each candidate, both the candidate supervisor and the colleges have roles in minimizing wastage of research output. It is immensely costly to the society, if not to the researcher. There are societal benefits and expectation on research. There is a written and unwritten. I wanted to put a picture on or a page of the informed consent, the national one, which is what most consent. There is a contract that the researcher has signed to the finding from that research. So there is a written and a written contract between the researcher and the partner that the outcome of research will be disseminated for common good. There are many research that are not of direct benefit to the each participant. They are not immediately benefits. So a lot of questionnaire, for example, they may not be of direct benefit to the participant, but there is that altruism that, okay, let me do it for the sake of society. Somebody maybe so, it could be of benefit to me later in life. So researchers and research institutions hold research participants who represent the society, the findings of research. There is a drive for what we call open science, open research. So a lot of journals are trying to go open access. And they are even talking about open science, open data, open your data. I know Professor Njokanma used to make a comment that he's probably going to get to the point that as you are coming to exam, you are coming to the college for fellowship examiner, you are asked to come with your data. It's not new, it's not strange. Actually, some journals require sets in repositories. That's where science is progressing to, so that people open, there's transparency and all that. So, what's the researcher's role in dissemination? Submit to college. Now, when we talk about research dissemination, actually, one can argue that the fact that I submit a dissertation to a college is at the basic level a form of dissemination, because the colleges, they actually hold society a basic duty to make to contribute to the dissemination. So submit to college, it is sacrosanct, it is basic if they are not made available. In some institutions, they have digital repository.
Dr. Bwani, sir. Dr. Bwani, sir, you're no longer sharing your slides, sir.
Hello.
Am I audible, please?
I can hear you. It seems he has been locked out or something. Can you hear me?
Oh, okay. Okay, so please bear with
Maybe
us a
at your
few
house.
minutes. Yes, ma. Thank you so much, ma. So please bear with us a few minutes while Dr. Bwani reconnects. I guess he had a network glitch. Welcome back, sir.
Hello?
Welcome back, sir.
Sorry, did you lose me?
Yes, sir, we did,
You
sir,
locked
for a moment.
the
Yes, we did for a
it seems
moment.
to have been locked out or something.
I was logged out.
Yes,
Oh
sir.
yeah,
So please
apparently.
redisplay. It was just for about a minute, sir. So you could just
Okay.
redisplay
So,
your slides, and I think you maybe when I see the slides, I'll remember where you were, sir. You can just redisplay your slide. It was just for about a minute,
okay.
sir. You were on the slide on dissemination. You had just finished talking about the fact that when presidents submit their research to the college owes a duty to disseminate. Otherwise, there's a loss. So yes. So I think self-archiving will probably be the
Okay.
next thing you were supposed to talk about, sir. Thank you, sir.
Thank you. Can you hear me?
Yes, sir. Loud and clear, sir.
Okay. So, on the part of the researcher, I can argue that, oh, uh, it's a form of disseminate that I give to the college. But it goes beyond that. The researcher has signed a contract with the participants to disseminate. So if it ends there, if it ends at just submitting to the college and the college is not running an open access in terms of it's not available to society, it's not about who is guilty, whether it's the researcher or the research institution. There is a wastage of that research. And it's not only the researcher, there is a stakeholder, participants made input into it. The supervisor made input into it, and people made input into it. So we must begin to see research as from the point of a communal thing, and that the benefit is not just to the researcher. Yes, maybe 80% of that benefit is due the researcher, but it's a shared thing. And how does research not just end, locked up, wasted, and it's not of value to changing practice or assisting practice? You see, I talked about quite a number of reference values. What if those reference values are not available? That we have reference values for blood pressure, but we are not using it because it's not accessible. It's a loss to society. It's a loss to healthcare. So now, what are things researcher can do? Self-archiving of one's dissertation. Even if one cannot, the best is to get to the point of publishing, but at least the minimum, a researcher should self-archive. But you have to keep in consideration copyright. I'm not sure what the copyright is between us and college. There's no defined copyright. So but I can say that at a minimum, upload your abstract in public repositories like ResearchGate. When you look at the summary of dissertation, it contains so much and it is useful to society. It is useful to society when I know that, oh, so the children with cerebral palsy that I'm dealing with in the neurology clinic, they could be having you, they are at high risk of UTI than healthy children. That information can improve practice. It may not be directly useful to that researcher at that time, but it is for the good of society. That's why the mothers agree. Okay, doctor, use my child for this research. So then, well, maybe this just to let you know that you can publish your data sets. But I won't go into that. But there are special repositories for that, and there are journals that many of them will not force you, it's not mandatory, but they will give you the options. And then, but where it's likely that as things are changing to become mandatory, that for you to publish, you have to submit, you have to have posted your data sets in a public repository. My own dissertation data set, they are in the public. So anybody can verify what I have published, my analysis and all that. They're in the public domain. Anybody can access them. But of course, there are some copyright there. Nobody can publish without including me, without informing me and all that. So that's where one of the places science is going to, publishing your data. Then present at scientific meetings and conferences. So our HOD has been pushing for that. That's very valuable. If it's just one abstract you take from your design and you publish it, it can make a lot of good to society. It will be findable and to be of benefit to society. And then the ultimate is actually to publish in peer review journals. So what are the roles of trainers and institutions, department, labs would call it training and practice of ethical research design, conduct and dissemination. We do a lot of training in research design, in conduct, but maybe for with respect to dissemination, which include publication and all that, I think there's a lot of assumption. We probably are assuming that.
Dr. Wanisa, Dr. Wanisa, I don't know if anyone can hear me. Dr. Wani, we can't hear you, sir. Can anyone hear me, please?
We can hear you.
Okay, thank you very much. Dr. Wanisa, you bear with us. I think our speaker is having some challenges with his network. Please just bear with us and give us a minute or two to reach out. Okay, he's been logged out, so I guess he will reconnect in a minute or two. Meanwhile, please permit me to say that if we have any questions so far, we can type our questions in the chat box. We might be able to take a few questions audible, as if you are mute and ask. But in the interim, we can begin to put
Hello?
our questions or comments in the chat box. Welcome back, sir.
Okay, I'm
Yes,
almost
sir.
done.
Welcome back, sir.
I'm almost done.
Yes, sir.
So I was
So
saying,
you can display your slides again, sir. We can't
uh,
see your slides, sir.
okay, I don't know what's happening, why that is happening.
Network doing its thing, sir. Okay, we can see your screen now, sir.
Okay, I'm almost done. So, poor intra-departmental
Yes.
dissemination. What I mean by this is residents are in a training program. They're also being trained for research. We need to have a way of they know more about the research activities in the respective unit and all that. Okay, so this was one of the questions. Do you have any manuscript about to be published? I've shown you the question. Oh, have you published? No. So out of those that said they've not published, look at this. 61.1% have. Do you have any manuscript about to be published? So that's a good one. Now, could you indicate any challenge with publishing from your dissertation? This also, okay, those that have not published at all. Ops, they have not published at all. So what are the challenging with publishing from dissertation? For eight, that's 44.4%. I need help or guidance with publishing. Then another 44.4%, I am hopeful or longing to publish. So that means it is not that you can see, I am not interested, 0%. Even with respect to, I don't have or I can't find the time, just two, just about 11.1%. I am not motivated to publish another, 11.1%. So, but at least we see that it just shows that we need to be more intentional in training and mentoring residents to learn about scientific publishing. Now, opportunities, the challenge of AI. I've talked about this. Training and mentorship in ethics of research design, writing. Sorry for all these typographic errors and dissemination, culminating in peer reviewed publishing. Presumably, residents who have. I want to take note of this. Residents who have participated in publishing are more likely to publish from their dissertation. I mean, if once publishing from dissertation is the first publishing experience of a resident, it will be more challenging than residents who have been involved in publishing as well. So that's why I want to implore the resident, this opportunity the HOD is talking about, publishing abstract, you need to take it serious because it's something that capacity is built in residency, not after residency. So I can tell you that as I look at the people who have published at least dissertation, most have published during residence. And the other aspect of it holds true. So we should consider a departmental repository of research. What I know is that, for example, I remember as a 300 level biochemistry student, when internet had not come then, oh, you can go to this repository where dissertations and all that are. As a residency training program, we need to have that. I know Professor Njokanma and others have spoken about that before, but we have not implemented it. Then we should encourage our residents to publish negative finding. Now, you didn't find p-value in the association between a study does not diminish the value of that study. So then there should be responsible use of AI. The West African College now has our residents should look at that guidance on use of AI. I've not looked at it, but it's something that we should all look at. I'm not sure about the National Postgraduate College. They may have. And then the opportunities is that we need to position ourselves research-wise to attract grants, attract funding, collaboration, and all that. So in conclusion, LASUT Pediatrics Residency Program has come of age, contributing immensely to usable, very usable, they are very usable data and findings output for improved clinical care of children. However, maximum societal benefits can be further enhanced by better dissemination. So thank you very much for the opportunity.
Thank you very, very much, sir. That was quite insightful, stimulatory, and you can see all the reactions online. So thank you so much, sir. So we will take a few questions and comments. I can already see that our father, who we are celebrating today, has